on, Mo. Good boy. Come on.
Welcome to Moments of Experience, a podcast inspired by my faithful best friend, Mo, a 14-year-old beagle who gave us moments of hope, compassion, and love during a time of tragic loss and life-threatening family illness. I'm your host, Geoffrey Smith, and I invite you to join me for powerful, uplifting, and sometimes even challenging conversations with some of the world's leading innovators in employee, patient, caregiver, and human experience. Together, we dive into the meaningful moments that shape us, move us, and inspire us to pursue our purpose in life. I'm glad you chose to join us as we explore the big and small moments that bring meaning to our lives and connect us to our true calling. So welcome to a brand new episode of Moments of Experience. I am so excited to chat with my guest today, and I know my listeners will be very excited to listen. As people know that listen to this show, I don't read canned bios. I think they're boring. So I always introduce my guest in my own words. And Darlene Cunha, a nurse, a transformational healthcare executive, an author of heartfelt content, and a human servant, reconnecting the healthcare leaders of today and tomorrow with their healing purpose through Caritas-driven leadership. That's how I see you, Darlene. Please introduce yourself in any way you see fit.
Yeah, that was beautiful. And it really captures who I am. You know, I'm a nurse by practice, but I'm a friend and a mother and a caregiver. I think most importantly, and having the clinical background just helps round everything out. But yeah, I've been in healthcare more than 4 decades. It's kind of scary to say that, but I've been around that long. And I've seen a lot of transformation, and some good, some not so good. I think when we're able to sort of step back and really reflect on the changes that have occurred and find our purpose, find our center, find our humanity back in this work, whether it's healthcare or any other industry. I think we've sort of drifted away from who we are as a people, which is kind and loving. So that's me in a nutshell.
Yeah, and it's amazing to me, and it's something I didn't really foresee when starting this program, because what I wanted to do, we don't have to go far to see where healthcare is going wrong. That is out there. We can see that whenever, but I wanted to point out the innovators and the pockets of brilliance of where it's being done right. But one of the things that's really taken me aback is when we go through people's moments, and I've read this on you, and I said this in your intro, the reconnecting the healthcare leaders to purpose after the broken systems and things kind of tear it out of them. And everyone gets into healthcare because they want to heal, because they are loving and caring and want to make an impact. But when the difficult systems and the changes you mentioned that aren't so great occur, we need people like you to figure out, how do we reconnect? How do we reconnect to the reason we got in this after, burnout and cynicism and exhaustion has taken it out? So I appreciate your work and focusing on that reconnection, because almost exclusively to a person, when I ask for the moment, it is not that original connection. It is the reconnection.
Yeah, 100%.
So I start the show. This is the reason I invite guests on the show. Something has resonated with me about your work. I've learned something from you, or both. And first, I would like to stop and just say thank you to you, because you have been such a amazing contributor to this program, even though this is the first time you've been on, by your very thoughtful comments and observations of previous episodes. You comment on almost every one, and it's done so thoughtfully and so insightful. I feel like you've been a part of the show even before today. So I want to thank you for that.
Oh, thank you. Well, I have to be honest, Jeffrey, your podcast is very different. It's personal for me. Um, because when I comment, I like to peel it all the way back, right? Peel back what is being said and what is not being said. What is that underlying tone or voice that we're trying to bring forward, right? And so I love to kind of reflect on your podcasts and your guests and what they've had to say most recently. A beautiful, beautiful guest and looking at that reconnection. Um, but truly, what you do is you are reconnecting. You're reconnecting people back to their purpose. And their purpose, regardless of where they are in life. What is your purpose today? Where's your core? That's what really resonates to me about this podcast. So I'm so grateful you thought I would have a voice that people would want to hear to be part of this because I'm excited to share in something I so believe in. The work that you're doing is transformational. It doesn't have to be loud. It just has to resonate. It has to strike a chord. What's the nugget that you take away that you can use going forward? There's always a nugget. You always bring something forward that hits me and makes me want to be better. So thank
Well, I
you for
think what
that.
it is, it's the amplification of those sometimes invisible moments that the masses don't always see, but they're happening. It's like the story of my wife's food service employee that sang to her when I was working with the CEO of that 27,000 employee health system on their engagement program. And I mentioned that to him. He just looked at me like aghast. Like, I had no idea things like that go on through our walls. So if we can find where the pockets of brilliance are in healthcare and amplify it, I think it gives us hope that true transformation is possible. And this is where I really want to start with you and what I've learned from you and what I want to learn more today and what I know my audience wants to learn more. When we talk about things like love, caring, dignity, compassion, gratitude, empathy, Caritas, in the world of work, in healthcare and beyond, many times those are considered soft or feelings or philosophies. And what my very first guest that came on the program, the name of the episode was Putting Compassion into Practice. And that's what you do. You take these perceived, I don't necessarily agree with that, soft skills and feelings, and you turn them into practice. And I want to quote you in a recent post, and we'll have Darlene's LinkedIn in the show notes, and please follow her because the content is heartfelt and always thoughtful and inspiring. But to quote you, you said, "Love expressed through action, care expressed through attention, and dignity expressed in everyday moments." And I want to lock into each of those because there's a word in each of those statements that is used on every single one of these episodes. Every single one of my episodes are using the word action. Okay, in the first, love expressed through action. How do we take data, soft skills, love, compassion, how do we turn it into action? Because that's many times where healthcare misses. Whether it's infrastructure, not feeling like they have the people and the resources to stand up a people project or stand up a new engagement platform or whatever. We have the data, but we don't take the action. So that one, we talk about that every show. Care expressed through attention. I have been privy to some of the world's leading researchers on people, performance, team dynamic, and engagement at work. And you know what the secret sauce to engagement is? It's attention from the local team leader. not the CEO, not the CHRO, but attention from where the work is happening. In your world of nursing, I talk often about how do we turn a span of control into a span of attention? Because that is the secret sauce to getting our arms around the most critical workforce on the planet. And the last one, dignity expressed through everyday moments. I don't think I need to get deep here. This show is about those everyday moments, about the small moments. And it's about the moments that, as we talked about, reconnect to purpose, that inspire. Pantabetti, as I just referenced earlier, my first guest, she said compassion is one of the few things in life that impact three parties: the giver, the receiver, and the observer. How do we take these everyday moments and make sure more people observe them? So we create a snowball of these quote unquote soft feelings: love, caring, dignity, compassion, gratitude, empathy. And the fact that you bring these to practice, I want to ask you, like, how do we connect this practice into measurable outcomes? And as I looked up kind of your background and some of the highlights and everything, you talked about various outcomes that you have improved in healthcare environments. And just to name a few of them, workforce sustainability, improving patient experiences, organizational resilience, being able to scale meaningful well-being initiatives and connect them to key performance indicators, KPIs, because many times where I like to say healthcare is at the forefront of critical innovation, yet lags 30 years behind the private sector in people strategy. And building the business case, Panta says it. Why do I have to build a business case for compassion? And you may feel that frustration as well, but what you have done is you have built the business case through real financial implications. And I want my audience to hear, because I'm going to throw out a few things, a few highlights that you've had on results. I read that you had a $32 million year-over-year financial improvement in a medical center during COVID recovery. You've impacted nurse turnover over 33% in one case, and multiple instances of patient experience. And I love the fact that you say you work with workforce and patient-centered systems, because too often employee experience and patient experience are in two separate ivory towers, and they don't communicate enough together. So I'm going to ask you a really hard question. Healthcare administration many times moves the goalposts on us. They don't give any program or project true quote unquote credit for these huge financial implications that we all know investing in our people. I got the answers to the test. I know investing in workforce well-being, mental health, engagement, I know it impacts HCAHPS. I know it impacts retention. I know that. But healthcare systems are so hesitant to give us credit for the ROI that investing in the most critical workforce on the planet brings. So can you talk about how do we tie all of these love, caring, compassion, gratitude, Caritas, how do we tie that to financial outcomes to truly scale these projects?
So it's interesting, right? I'm going to kind of peel the onion back for a minute before I get to, the answer, because it's sort of multi-layered. Recently, I was a nurse executive change coach for Trinity Healthcare, and we were bringing forward a new model of care, virtual nursing. And so we had to implement this new model of care. And we have to not just look at the project, we have to look at how the project affects the people receiving that new model of care. That's both the patients and those embedded in it. So every caregiver, from physicians to nurses to respiratory therapists, pharmacists, who are ever going to intercede in the care plan of that patient needs to understand and accept that new model of care. When I went on to the different units, I'm a firm believer of Gemba. You go to where the work is being done. And so I started walking the many different units, not even the units that were going to be adopting this new model. I wanted to get a feel for the culture. What was it that was working or not working? Because that was going to directly impact the project. And it didn't matter how many resources you had. What mattered is whether or not people felt seen, felt heard, that their voices were going to help shape the model. So we did pilots, right? We tested it. But here's what I found. There were units I went on where the staff, when you entered the unit, would say, "Hi, welcome to West 4. So good to see you. Can I help you?" And I would engage in conversation and tell them I was just there to, walk around. I was from administration, et cetera, et cetera. And then I saw the nurse manager come and I stood back and I watched her interact with her team. And the nurse manager was, "Good morning. How is everybody? Cheerful, loving, engaging, Tell me something good that's going on today. What's going on? Tell me something good," right? I always start a meeting with, "Tell me 3 good things." What's going on at home? Because it's got to be relational, personal. What's good at work, right? And then what's good in the hospital? What's good, around you in your community, right? So tell me 3 good things. And she was doing pieces of that. And so I said to this nurse that greeted me so warmly, I said, "Wow, you can really feel the love up here." And she said, "Oh, that's because of, Mrs. Jones, our manager." I said, "Really? Tell me more about that." And so she went on to share how she starts every morning by rounding and really staying present when she asks how things are going. And she pays attention. She knows body language. "Darlene, you don't look like you're having a good day today. What's going on?" That's important, right? So we can get caught up in the fast pace of things that are happening all around us, and we become very task driven. "I got to get to my next meeting. I can't be late. I'll get back to you." So you just basically shut them down. Then I went to the floor where the model was going to be implemented. I was not greeted. Nobody even recognized I was on the floor. I could have been anyone or anything coming on. There was a lot of hesitancy about the model, lots of questions, pushback. And I thought, what is the secret sauce over here? And why haven't we sprinkled it over here? Right? And so I started to peel that back a little bit more and I started to talk to the manager. It was multifaceted, right? I mean, we all get sort of swallowed up with responsibilities, but if we haven't trained and provided the resources for good leadership, whether it was with that organization, I've seen it in other organizations I've practiced in as well. Where I was chief nursing officer of the organization, I had units that had no turnover for years and units where the turnover was churning through. I couldn't keep up with the nurses that were coming and going. Why was that? Right? When you build a loving organization, dare I say the word love, right? Because healthcare is love. When people feel it, it's the universal language, right? Gene Watson has a saying that says, "Maybe this one moment with this one person is the very reason we were put here on earth at this time." Make that moment count. And so when you can start to um, really get to the bottom of the culture on the unit, it will spread. Now, it can spread like a cancer, or it can spread like sunshine and illuminate everything, right? But then you have to take it back a little bit further. And one of the brilliant things that I did in my former organization was I started working with talent acquisition and HR. How are we recruiting? How are we welcoming our new employees? How are we folding them into this beautiful culture and providing the resources for success So they want to stay, they want to grow, they want to be part of something bigger and more meaningful. I had opportunities to move on from some of my positions. I didn't leave because I loved my boss, I loved my team, I loved my unit. You stay where you feel you're adding value. And here's the key. I have found in my decades of practice, when your staff stays curious, they ask questions. They start saying, hey, have we ever thought of ABCD? That would really help to improve this, right? When they're engaged, when they're committed, when they feel important, they want to be part of something bigger. They want to keep contributing. And that curiosity grows. And they want to be part of a committee or a team, and they want to pilot new initiatives. That's how you build a culture of cohesiveness and you decrease turnover. And when nurses and healthcare professionals are happy, patients are happy. And when patients are happy and families are happy, they talk about it. And when they talk about it, it festers outside and people say, oh, I want to go to that hospital. I want to be part of that healthcare system because they really care. Nobody wants to work in an organization they're not proud of, right? You want to work someplace that you're proud of. And so we help to build that organization. For me, it is the cornerstone of everything in my being to make certain that I build that culture, because it doesn't matter how many resources you have. It doesn't. People will come back when they feel like they belong, when they feel seen, when they feel heard, when they feel like their presence matters. They come back and they want to be there. That transcends into real quality indicators for key performance indicators, right? As I said, they start to get curious, right? We have a problem with wounds. You'll have them coming up with all kinds of plans on how to reduce wounds, how to reduce falls, how to improve the patient experience. The last organization I was the chief nursing officer for, each of my managers on the units had a patient experience initiative that they were doing, which was different from each one. They each had their own initiative. Those scores went through the roof. When patient experience goes up, negative experiences go down, falls go down, call light wait times go down. All of the things that impact good clinical outcomes start to improve. So culture drives performance, 100%.
And there's just so much there, because I teach a different way to look at employee engagement in healthcare. And it's what you described in going to those two different floors. What I do is I say, let's not measure engagement. First of all, it should not be a once a year event or a survey. It is a living, breathing organism that can change shift to shift, patient to patient, and most importantly, team leader to team leader, because that's who drives the culture in a specific unit. In healthcare, sometimes it's not necessarily the team leader that trees up to a traditional org chart, because in healthcare, the teams that deliver the extraordinary experiences are dynamic in nature. We have food service working with social work, working with nurse leader, working, to create that experience. And when I was working with the healthcare system that was caring for my wife, there was one floor where everything was different. And I went to the CHRO and I said, I want you to pull HCAHPS patient experience scores for this floor. And he goes, well, Jeff, that's really not how we measure it, And I said, just do me this favor. And it took him a couple months, but he came back to me. He called me on my cell phone. He said, Jeff, through the roof, I've never seen anything like it. How did you know? And I said, because I felt it. I also felt the different feeling when I went up one floor or down one floor. So when we recognize the pockets of brilliance inside our healthcare system, I'll take it back to one of the three words I used at the beginning, action. We can take action when we find those pockets of brilliance, because we can answer one question and one question only by looking at it bottom up versus top down. How do we make more teams like our best teams? And that's really what you're talking about here on doing this. But it's amazing to be able to, and by the way, and I'd love your thoughts on this. I have found that no matter, the only KPI that I think resonates throughout a whole health system is patient experience. So when I work with groups, I know the answers to the test. If I'm working on an engagement platform, if I'm working on a real wellness program, I had a nurse on recently. She said they built these wonderful wellness rooms. I've never seen the inside of one, but they built them for us. I've never had the time to go, but when you do intentional wellness and well-being and mental health and engagement, it's about connecting the HCAPs to where we do that. So we roll out a program. I like to roll out programs small and say, let's do this floor or let's do that. Because then when I connect it to the KPIs and they're like, whoa, look at they'll never give me credit for retention. I don't know why, even though I've proved it out a million times. But if you can connect a people project to HCAPs, patient experience, that resonates with everyone in the C-suite. And so I'd love your thoughts more on how do we tie these KPIs? How do we tie these financial metrics to building a business case for investing in the most critical workforce on the planet?
Yeah, I think, administration is seeing that now, to be honest with you. I think their eyes have been opened, and they know that patient experience is a driver of financial sustainability. I mean, it truly is. Good patient experience scores are tied to reimbursement. Your commercial payers look at that, and that determines your scale of reimbursement. There's a piece of that that's tied to it, right? We know that Medicare is looking at that. Patient experience is vital. And again, it goes back to employee engagement and employee experience. If I'm miserable and I walk into your room and I don't have any eye contact with you, I treat you like a piece of paper. I'm looking down, I'm very rote. You feel isolated. You're afraid to speak up. You're afraid to ask questions. You're afraid to engage, and you want to be discharged. Or you ask for a new nurse or a new provider. But that just shifts the responsibility to another clinician who may be part of that same group of miserable folks, right? And so I'll tell you, one of the things that I did early on, Jeff, is I showed my teams that video from Cleveland Clinic, and I don't know if you've seen it. If you haven't, I highly recommend you watch it. And if you just Google the Cleveland Clinic video, it'll come up. And it's patients walking through the door, staff walking through the front door, into the lobby, and then you see a message above their head, just given news about, a test result, and they look worried, or just found out he's going to be a father. And so there's a wide range of emotions. And the reason why I would show that video, and I've shown it at my executive leadership meetings, is because we never know what people are bringing to the table, whether it's a provider, a caregiver, or a patient, right? And so we always have to go in with the intent of being kind, loving, present, caring. People open up to that. I've heard, well, how do you know when you're in a loving organization? 3 words, you feel it. There's a difference. It's in the air. You feel it, the way people greet you. You're walking down the hall. Quint Studi used to say, if you're 6 feet apart, you need to be locking eyes. And when you're 3 feet apart, you need to be saying good morning, right? It's connecting. Are we connecting? When we show, and this is how I proved my turnover rates, my HCAP scores, my colleague, there's a question on your colleague experience surveys that we would send out, and it says, do you plan to leave the organization within the next 2 years? And so that is very telling. If they say yes, why? Are they unhappy? Is there no growth path for them? What is the root cause of that? And then you start to look at clusters of where it's occurring, what department, right? Where is it happening? And where do we have opportunity to improve that? We started to be able to show when we invested, and it wasn't about big programs. We weren't talking about adding dollars. We were talking about presence, giving 2 hours of, we call it the no-go zone. So in the morning when that manager arrived from 7 to 9, she was not in meetings. She was on the floor connecting with her staff, checking in. How are things going? That presence started to flip the switch. And we had more employee engagement, people joining councils, people wanting to be part of the change on the unit. That ties to real money. As a former chief operating officer, I had a dual role at a system in Rhode Island, a 2-hospital healthcare system, plus a federally qualified health center, large physician practice group too. And I was chief operating officer, and for 11 months, I had the dual role of being chief nursing officer as well across the system while we recruited for those leadership positions. And it showed me a lens of not only are we looking at return on investment, because we all know if there's no margin, there's no mission. We have to be profitable to reinvest, but at what cost? And, we don't want turnover. We don't want miserable employees. We want employees who are engaged and asking their friends to come work there because they feel like it's different. We were able to show that engagement equaled higher retention rates because we implemented these different projects in different units and were able to measure before and after. And then we measured consistently for 6 months to trend it. Is it a fluke because it's fun and it had a bump and now it's down again? No, we saw consistent rises in numbers. And then we also saw a decrease in patient events. And we saw an increase in reporting of potential events, near misses. That's a culture of safety. People feel like they can safely report, and that this helps us to determine where we have opportunity to improve our systems, right? To improve our policies and procedures and programs, our fall program, our wound program, whatever it might be. If you're consistently reporting near misses, so when we saw near misses go up, but actual events of bad experiences or an untoward event go down, that tells me the system's healthy. So we started to see that shift, and I presented that to the board. I presented it to our executive committee, and it's indisputable at that point. It's indisputable.
Well, it's connecting the dots for these people. And I think one of
Yeah.
the things that I take away from this conversation is the word you use is curiosity. Because I think when people feel seen, heard, and valued, they feel very comfortable suggesting new solutions, very comfortable giving ideas, but when you work in a fear-based versus a love-based, everyone's clams up and doesn't give different solutions. And so empowering our teams to get curious, I think leads to a lot of great things. And I commend you very much because this is the best story I've heard in my decade plus in healthcare of connecting the dots that made something indisputable. And so that is highly encouraging to me. And I hope my healthcare executives and my nurse leaders listening and everything hear this and because investment in our people, and you touched on this, and not just, I had a group one time tell me, yeah, Jeff, I see how we should do some of this engagement stuff for our nurses, but I'm not sure we do it any further from the nurses. And I told the story of that food service employee singing to my wife, and the tenor of the meeting changed, because everyone realized that every single touch point at a health system, you mentioned it in the Cleveland Clinic video, and I've heard wonderful stories from that group over the years. Every single touch point has the opportunity, when people are at their worst coming through those doors, when they're scared, when they're nervous, when they're uncertain. Every single touch point at a health system has the opportunity to create an extraordinary human experience or not so much. So I think by you connecting all these dots for and I'm also happy those organizations were willing to hear that and willing to see the presentation of all those things. And also I appreciate any situation where employee experience and patient experience work in lockstep, because I see too many times it not. And I don't get that. I just don't understand it.
It's interesting. I have a couple of points. My thoughts are racing here. You've brought so many great points up. So the first thing I'll say is, any new initiative you take, you have to be resilient. If it's not going to be 100% out of the gate, and you got to pivot. You got to keep moving forward, right? Because the end goal, is success, whatever that success might be. We're going to reduce falls or whatever it might be, right? If the falls don't go down the first month, okay, let's relook at what we're doing. Why are they not going down? This happened on one of the units that was so upset and said, this just isn't working. And they wanted to start from scratch. And I said, what is working? And what they didn't realize, they were thinking about the physical space of the patient and not taking into consideration that this was a traumatic brain injury floor. So the cognitive impairment, the short-term memory lapses of the patient, to call, don't fall, to reach for the call bell when you need to get out, wasn't going to work. So let's come up with something different. Let's invite psychiatry in and see if they can give us some feedback to help us. So it's multidimensional and certainly multi-departmental, right? There's got to be multiple eyes, whether it's the housekeeper coming in and emptying the rubbish and the trash and looking around the room to make sure it's safe. So resiliency, you can't give up when the project stalls, or you're not seeing the expectation early that you had hoped for. You keep moving forward with that curiosity. Keep asking yourself why, right? That's so important. The other thing I think about often is, you had just mentioned it, and I was thinking, with the Cleveland Clinic video, people don't come to work with the intention of hurting somebody. They don't, right? Policies, procedures allow for that gap, or that workaround to occur. So we got to look at anything that's untoward as an opportunity for improvement, an opportunity to reframe, an opportunity to not look at the person, but look at what may have impacted the decision, right? And then the last thing I wanted to share, because for me, this is like the very core of what I do. When people come to a hospital or a clinic or a doctor's office and they're sick, you have a duty to be patient and kind. And you have to remember that it is an honor and a privilege to be invited to that bedside to care, or that chair or that office, to care for that patient in their most vulnerable moment. To diminish it into anything less as a task to be completed, check, 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 We got to get so many people through the office. To diminish that experience is to tell that person in front of you, you don't deserve my time. So take that moment, sit at that bedside, eye level, don't talk down, talk to the person, and let them know in that one moment they matter. We did a study. I did this study years ago, and I've repeated it multiple times. It's called Commit to Sit. And we put a stool in every room that had a bright orange seat. And it was just for healthcare providers, just for caregivers. And the expectation was, and there was a message outside the door to the room that said, commit to sit. And the expectation was when you went in, you took that orange stool because you couldn't miss it. And you sat down and you talked to that patient for whatever it was you were in there for, to give a lab test result, to tell them their plan of care, discharge planning, whatever it might be. We asked the patients, we went back and talked to patients and we said, how did you feel when Dr. Smith came in to see you? Oh, it was wonderful. He spent so much time with me. Really? Yeah, he was in here for at least 15 minutes. I've never had that before. I said, wow. And we were timing each visit. 2 minutes was the mean. 2 minutes. But when you sit, that presence feels like it's longer than it actually is. So the patients feel connected. They feel important. So dignity and respect. It's an honor to take care of patients at their most vulnerable. And we can't forget that.
An authentic presence. The power of authentic presence. I had a guest on, Dr. Stephen Beeson. He said, we all have a choice of who we want to be in this life. And we all have a choice of how we show up to people when they are at their lowest, when they are at their most difficult. And the other thing I found interesting about this show is many times the moments shared on this show are with poor clinical outcomes. And the power of connection and presence with a family when the answer wasn't what everyone hoped across the board, and the love and compassion and the connection, the human connection that occurs when you're in failing health. And it's been amazing to hear those stories, but we could go on forever. The name of the show is Moments of Experience. And I want to ask you, Darlene, what was one of the moments that shaped you, moved you, and inspired you to do the work you do every day?
I'll go back when I was just barely a teenager and I was volunteering at a nursing home and meeting with the elderly patients. Part of my 4-H program, we had to pick something that we did for community service. And so my neighbors owned a nursing home that was right behind our homes, bordering another street. And so I would walk over and I would go through all the different patient rooms and I'd talk to the patients. But there was one patient, and I'll never forget her name, Mary Wakeling. She changed me in ways that I can't even articulate. Her room smelled like lilacs. I can still see the pictures of family on the wall. We had discussions like she was my grandmother, of the importance of not forgetting family, that family is the thread of who you are, your tapestry. Your friends are an extension of your family. Who you surround yourself with helps to shape who you become. We talked about family. We talked about her life and when her children moved away, what that meant. And she shared with me how my spending time with her gave her purpose. She would wait for me to come so that she could share another story. And so what it taught me was that power of presence, that power sometimes of silence, of just listening, letting someone share their story. And when they're able to share their story, you're able to create a moment, a plan of care, um, a, a relationship that you would not otherwise have had the chance to do. And so those relationships shape you. So from the time I was 12, you know, I've never forgotten that. And as I went on to nursing school, you know, I was known as the whisperer, right? Because I used to talk really soft and slow in patient rooms because I wanted to drown out the noise. And if I talked low, that meant they had to listen in a little bit more. And they would talk low too. You know, it's what do you want to be remembered for? What's your legacy? You know, and I have taught my sons that. You know, what would people say about you? What do you want them to say about you? That's what you want to live and what you want to breathe. So Mary Wakeling helped shape me when I was 12, barely 13 years old, and I've carried her memory ever since.
That's a great story, and it just shows. I think it's back to the presence, back to authentic presence, because you just never know when a small moment can be truly life changing. So I urge people, and they'll hear it again in the outro, but say keep your eyes open and be authentically present, because you never know when even the smallest moment can truly change your life. And in your case, it happened at 12, and it shaped you, and that's really amazing. So anything you'd like to share before we wrap up? This has been a great conversation.
Oh, thank you. You know, the only thing I would urge your listeners to do is to practice that loving kindness. We've seen compassion. I don't want to say erode, but sort of be compartmentalized. We want to blow it out of that can. We want to get it back front and center and not be afraid to show it, not be afraid to speak it, not be afraid to call it out. We call it out with young children. When we see a child being kind to another child, we tell them, oh, you're a good friend. But we tend not to say that as adults. We got to start calling it out more. And I think when we can begin to show that kindness, that loving kindness as a culture, it just breeds more loving kindness. So Caritas is nothing more than love in action. And so I ask you to practice more
And
love
I
in
think
action.
it comes back to, I just had my last episode, or 2 episodes ago, I had a founder of a recognition technology in healthcare that allows people to recognize their peers, their patients recognize their caregivers, because when we amplify those moments and we're able to share the stories of just the love, the kindness, the compassion, it's truly transformational, because it's a snowball. And to be able to shine a light on these moments will change the world. So I appreciate your time. Thank you so much for being here.
Oh, my pleasure. Thank you for the invitation.
Thank you for joining us on Moments of Experience. I hope today's conversation touched your heart and inspired you to reflect on the impactful moments in your own life. Remember, it's the seemingly small moments that often hold the most significant power to shape our lives and the lives of those around us. So keep your eyes open and do your best to be authentically present. If you enjoyed today's episode, please consider subscribing, leaving a review, or sharing it with someone who might benefit from our discussions. Until next time, I'm Geoffrey Smith, reminding you to cherish the moments that bring hope, connection, and purpose to your journey.